Okay, we're going to do 11.1 and 11.2. So this chapter is on health insurance, and we actually just have 4 lessons. So you'll have a test again right away next week. So I typed up the vocab and the formulas, so you can get those written down when you get a chance. So health insurance is what protects you against medical expenses. Traditional plan is a type of health coverage where the healthcare provider is paid a predetermined dollar amount for the service given. PPO, which is Preferred Provider Organization, is a group of selected healthcare providers who offer comprehensive services at preset reimbursement levels. And then HMO is Health Maintenance Organization, a prepaid health plan in which care providers contract with employees of the HMO to provide you services. The employees percent is just 100% minus the employer's percent, and the employee's contribution is the total premium times just the employee's percent. So I'm going to do numbers 3 and 9 with you from your assignment. You will be doing, it's up here, page 418, 3 through 10 all. All right, so number 3 is a single PPO, although this doesn't really matter much for us figuring this out. And we're going to do the employee's percent. So the annual premium is $4,980. The employer's percent is 60%. So that means the employee's percent is 40%, because it's just 100% minus 60. And then the employee's contribution is going to be that 40% times 4,980. So you're just going to take 40% times that. And you should get 1,992. That's dollars. Okay. And so that's the employee's annual contribution, so the whole year. The monthly premium, then, you just divide by 12, and you get $166. So this person pays $166 for their health insurance every month. Okay. So you will do 4, 5, 6, 7. That'll be just like that. And then I'll do number 9. I'll do number 9 with you as well. So it says Lance Alpern has a single plan. The HMO annual premium is $9,255. His employer pays 70% of the cost. How much does Lance pay annually? So the employer pays 70%, so that means he pays 30% of that $9,255. So we're just going to take that times 30%. Okay. So I got 2,700. Let's see. So this is a 2,776 and 50 cents. And then for B, it says how much is deducted from his weekly paycheck. All you're going to do is you're going to take that annual amount, that $2,776.50, and you're going to just divide that by 52, because he has 52 paychecks if he gets paid weekly. And then that equals $53.39. So that's how much he's being deducted from every paycheck. Okay, so this one's pretty straightforward, and then we'll go on to the second one, health insurance benefits. And this has deductible, which is the amount of money you must pay each year before your insurance company starts paying. Your co-payment, which is a predetermined flat fee you pay for healthcare services. And then co-insurance tends to be a percent of medical expenses, but it can also be a set amount. And then your formula is going to be the amount paid by the patient is just add all those up, the deductible, the co-payments, the co-insurance amount, and then any hospital charges. So Your assignment will be 4 through 14 evens on page 422 and 423. And I'll do numbers 3 and 11. So these aren't actually from your assignment, but they're very similar. So I'll do number 3 here. So A says amount of the co-payments. Well, the amount of the co-payments is going to be, you have to read here. It says it's $10 each and you have 25. So you're just going to take 25 times 10 and you get 250. So that's your amount of your co-payments. And B is the amount of the coinsurance. Well, right here it says that your coinsurance rate is 20% and the amount subject to coinsurance is $12,000. So you're going to take $12,000 and you're going to multiply it by 20%, and then you get 2,400. So that's B. And then the total paid by insured, that's going to be this. I'm going to grab a different color. That's going to be this 2,400 that you figured out, this 250 that you figured out, and then this 3,000, which is the deductible amount. So you're going to add those three together. So once you add those together, you should get $5,650. Okay, so then you'll do the evens on that, 4, 6, 8, 10, and this other section here where you're going to do 12 and 14. I'm going to do 11 with you, but you need to have this figure that I posted. And this chart can be a little bit confusing. So you need to do A, B, C, and D. So I'll write those over here. And it says Sophia Carbondale has a network single plan. And that would then be, I'm going to circle stuff if my pen will work, single and in network. So I'll be looking at this column here. And it says that after meeting her annual deductible, she has these co-payments. 18 physician visits, so that's going to be here. 15 specialist visits, so that'll be here. And 15 physical therapy visits, 1 emergency room, and then a hospital charge. Where do they have the hospital charge? Oh, right here. Okay, so we're going to have to figure all those out separately. So A asks for the deductible. So the deductible is straightforward. It's just right here. It's just this $1,000. So A is $1,000. That's awfully bad written, 1,000. B is the co-payment amount. So the co-payments are going to be the physician's visits, the specialist visits, and then the physical therapy visits. So the physicians are $18, or 18 of them, and they're $20 each. So you're going to have 20 times 18. So I'm just going to jot that aside right here. 20 times 18 is 360. Okay. The 15 specialist visits, that's $30 each. So we're going to multiply that by 15. And I'll put that over here. That is $450. Okay. And then the physical therapy visits are $90 each, but you're only paying 20% of those. So now you have to take 20% times $90 times the number of visits, which was 15. So you're going to take 20% times 90 times 15, and that's 270. So your answer for B is going to be the 360 plus the 450 plus the 270. And when I add those up, I get, whoopsies, $1,080. Okay? So that's the hardest part. C says hospital charges. So hospital charges are going to be this emergency room visit and then a percentage of the hospital charge. So I'm going to switch colors here. So the emergency room visit is $100. So we have $100. I'll just bring that out here. And then the hospital charge is $24,560, but they only pay 10% of that. So that's up here. So you're going to take 10% times the 24,560. I'll bring that out here. So that then would be 2,456. So to get your answer for C, you're going to add up the 2456 and the 100, and you should get 2556. The last one, D, is the total paid by the insured. So all you're going to do for this one is you're going to add up your A, your B, and your C. So you'll take your 1,000, your 1,080, and your 2,556, and you'll get a total of $4,636. I know these ones are a little bit more difficult, but you'll just have number 12 and 14 to do on that page. Let me know if you have any questions, and good luck.